heart attack risk halved in those with heart disease taking tailored doses of vitamin D. Now, what makes this study quite unique is this. What researchers wanted to do is actually measure the blood levels of vitamin D, not just the consumption of a vitamin D supplement per se. So their target was about to get the blood levels about 40 nanograms a milliliter and keep that range between 40 and 80, not any higher than 80. And of those that, how would you say, achieved that target level of 40 nanograms per milliliter, it was about an average of 5,000 IUs per day they were taking per se. The results were quite remarkable in regard to helping with heart disease prevention. Now, ironically, after the 4.2 years, a lot of individuals, about 21% to be precise, did not make that target level, even with tailored dose of vitamin D after 4.2 years. Now, the interesting part about it, when individuals came in, about 85% were deficient in vitamin D that had heart disease. And the average amount was about 26.8 nanograms per milliliter. So without further ado, let's get right into the study as follows. Well, let's look at the data first. So here is how the study was done. Look at the adults and how they were followed, and you see basically the starting baseline they had to work with, 26.8. 85% were already deficient. These individuals which should be paying particular attention to vitamin D levels, but however, though, right off the start, boom. And there's the treatment strategy. To go a little further into it, 21%, as you look a little farther down, still did not make that 40 nanograms a milliliter, which is really interesting because even though that's a secondary outcome, I'd be quite curious to why that 21% could not achieve